when it comes to men's health, there are two problems that can be a little embarrassing to talk about. Erectile dysfunction and urinary incontinence affect a lot of men. But as ABC 2 News' Linda So reports tonight, there are also a lot of treatments out there to get better.
Frights a lot of people.
Roy Brinkley has been through a lot. He had prostate cancer and had to undergo surgery. The procedure saved his life, but it led to another problem.
It's embarrassing, and I didn't have that much leakage, but any amount of leakage is too much.
Roy developed urinary incontinence.
I had pads in every pocket that I had, especially if I was going somewhere that you had to dress, or if I was on a trip. And I still find pads to this day, 2.5 years later, where I have stuffed them.
Good morning, Mr. Brinkley. How are you?
Dr. James Smolev, chief urologist at Good Samaritan Hospital, says diseases like prostate cancer and diabetes can lead to urinary incontinence and erectile dysfunction.
Men are most interested in correcting the incontinence or the leaking first. And once that's been dealt with and they're not wearing pads and not leaking urine, then they may or may not want to deal with the erectile dysfunction.
There are various options to treat the two conditions, including medications and surgery. Roy was treated for both incontinence and ED. He says it changed his life.
I feel like I'm 40 years old again.
For a lot of men, getting help for incontinence and ED can be embarrassing. But Dr. Smolev and Roy say there's nothing to feel bad about.
No different from somebody who has diabetes and needs insulin or has pneumonia and needs antibiotics. This is a physical condition.
If I can tell my story, it will help some of these people make up their mind, because they can't go out in public and talk about it.
In Northeast Baltimore, Linda So, ABC 2 News.